Have they?
Yeah, that's like transportation.
Why?
Well, apparently, it was discussed at the lunches that, that, that the legislation is just.
Well,
We can do whatever you'd like. I just would
okay.
like to be able to tell them now if we're.
Right. Yeah, I don't think our agenda is too aggressive that we can't take some public comment if, especially because we don't have the appointments on there.
Okay.
So if everybody's fine with that, I'm fine with that. So do we wanna, Takia, if we call it and we discuss it, can we still also postpone it, or do we have to
We can postpone it.
favorable or not? Okay, sounds good. Let's do it. Calling to order the Housing and Human Welfare Committee meeting on July 17, 2018. I will start by taking a roll call attendance of the members present. Alderwoman Tierney,
Present?
Alderman Payon,
Present.
and myself, Committee Chair Shanika Henson, Alderwoman, Ward 6. On the business before the committee, first is approval of the minutes from our last meeting. Is there a motion to approve the minutes?
Madam Chair, I've reviewed the minutes and they appear to be appropriate, and I would move their approval.
And I would second that.
All in favor?
Aye.
Aye.
The minutes are approved. Our first presentation is ID number 22518, presentation from Francis B. Phillips, the Acting Health Officer for the Anne Arundel County Department of Health. Ms. Phillips, thank you for joining us.
Thank you, Alderman. Thank you, members of the committee. It's my pleasure to be here, and if I may, I'd like to invite my two colleagues from the health department to join me at the table.
Thank you.
To my left here is Ellen Jones, who's the department's public information officer, and Don Kurian, the department's acting environmental health director. So we do have some information to
Thank you.
share with the
Thank you
committee.
very much.
Thank you.
Take. Thank you.
Ms. Phillips, could you make sure that the microphones are on at the table so that...
I got a green light. Thank you.
Excellent. Thank you.
So it's my pleasure to come before you as the city's health officer, or I should say acting health officer. This is a position that I've been in return to now just over a year.
Ms. Phillips, I'm told the microphone is still not on.
I'm seeing a green light. So is it on now? Now I'm seeing a green light. Is it on now?
Is it?
Is it on now? Yeah.
Thank you.
Okay, all right. Anyway, to start again, it's my pleasure to be here representing the city's health department, which is also the county's health department. And that's a point that I do want to stress, that
All of our services are available to all of the residents of Annapolis City as well as Anne Arundel County. And it is a border that our staff do not take with any kind of, I certainly don't want to say it's like a North Korea, South Korea. We serve all of the residents of both jurisdictions and do so generally in a uniformed way. I will say generally because there are a few instances that we can speak to where the ordinances pertinent to food inspections and some other the regulatory activities in the city are different from those in the county. And so we recognize and we honor those differences with respect to the two jurisdictions. But by and large, public health services, public health issues cross the boundaries between the jurisdictions, and certainly the services that the county health department offers do as well. As I said, I've come back here now in an acting capacity as part of County Executive Shu's cabinet. Acting capacity was meant to be 90 days. It's been a year and a month now, so I'm all in. But it's a pleasure to be back. I served in the capacity of health officer for over 15 years, and in that capacity had the opportunity to work with Alderman Payon and some other representatives from the city, and it's a great pleasure to be back. It's also a great pleasure to be back with Alderwoman Pindell Charles, who has such a strong legacy in public health. She could be writing the book on public health, particularly in the city of Annapolis, and the legacy that she and her family have created in the past and then certainly going forward today. As you'll see in some of the materials there, one of our busiest health centers continues to be the Pearl Health Center, which is the locus of so much basic public health services, whether that's WIC, women, infant, and child nutrition services, immunizations, communicable disease control, tuberculosis, and the like. The Pearl Health Center has been the heart and soul of the community, and really we're very proud to continue to staff that building and that wonderful organization. So thank you for that opportunity. We're a large health department in relative terms. Every county in Maryland has a health department. We have the most extensive array of services, the core services being, as I mentioned, maternal child health, infectious disease control, and a lot of the other state and federal grant programs that are related to public health come through the county health department. In addition to that, we have the very, very active school health program, so that in Anne Arundel County, including all of the public schools in the city of Annapolis, it is the health department staff that operate the health room. And that's vitally important for students today as more and more students come to school with chronic conditions, come to school with the need for medication during school, some with the need for procedures and other kinds of pretty complicated, sophisticated medical support during their school day. So kindergarten through high school, we serve those students, and we are also fully engaged with those students in terms of their behavioral health needs, their mental health, and other kinds of social concerns. So our school nurses are terrific public health workers, not just for the student during the school day, but also for that student's family, and that goes 12 months a year. Another vital bureau of the health department is environmental health, and I'm going to give Don a moment to talk about the scope of services in environmental health that really does cover from food to water and to right now to a lot of summertime kinds of health protection activities. Very, very important for maintaining, on the prevention side, for maintaining good health. I have to say that the area that I have been completely engaged in since I came back to this office June 1 last year is in behavioral health. And in behavioral health in our health department, we include child and adolescent mental health. We have a very busy child and adolescent mental health clinic. But first and foremost, it has been the substance use, prevention, intervention, screening, treatment, recovery, the whole spectrum of services around what we're experiencing in the city as well as the county and the state, which is the opioid crisis. I say opioids in a very general term. Opioids certainly includes heroin, it includes OxyContin and other kinds of prescription drugs. Now it includes fentanyl and the other kinds of derivatives that we're seeing. It also, we now need to recognize that the problem has other kinds of of substances, so that the substance use disorder is now the term that we're using rather than opioids, because we're seeing benzodiazepines, other kinds of prescription and street drugs, cocaine, again, having a resurgence. So most broadly, I've lived in this county for 35 years. I pay attention to what's going on, I think. I was struck when I came back, as I said, a year and a month ago, to see the impact of substance use throughout the county now, throughout all zip codes and really all age groups. It's really phenomenal what has happened, the change that has occurred in the last 5 to 10 years, 5 years, I would say. Health Department has a full array of prevention, and I want to talk about prevention such as efforts that we work very, very closely with your police department, with your fire department, and with your Office of Emergency Management on moving out and doing training of naloxone, of Narcan training, vital training that keeps people alive, the Narcan being the reversal drug for opioid overdose. It's administered through a nasal spray. It is now, although it's a prescription drug, it's now available for people who get very, very simple, quick training, and it has saved lives in so many different settings. So the opportunity to provide the community, high risk, low risk community work sites with Narcan training and the kits themselves is really an effort that we're stepping up, working with, again, your police chief, Office of Emergency Management, and fire chief. I will say along those lines that the organization around the opioid crisis in the county has been fully integrated. Since I've been here, we've had an integration team that has included the city officials. And so just this morning, we met, as we do every month, with the city's fire chief, with the police chief, and with Chief Simmons on managing elements of this crisis. We don't see that this is a crisis that came about overnight, and we also don't see that it's one that's going to be resolved quickly, but we can and have made a difference. I'll tell you, we have some kind of good news and some bad news to share with you in regards to that, and we can talk some more at your interest. The good news is that overall, year to date, comparing this year with 2017, the overdoses that have been reported collectively, both through the city police department and the county police department, have remained basically unchanged. And so the good news is that we're not seeing new users. We're not seeing an increase in overdoses like we had the preceding years, where the overdose rate continued to increase. That seems to be leveling off now. So hopefully we have reached a plateau. There's a lot of effort there. I think there's just a tremendous amount of credit that needs to go to the outreach through the schools, through some community groups and the hospitals, such as the Not My Child presentations to parents. The physician community, AAMC, has really stepped up and taken on a lot of the community education around this. The bad news is that while we have pretty much consistent level of overdoses, this is true for the city and for the county, the fatality rate is going up. So what that means is that people are overdosing at about the same rate, but what they're using when they overdose is so much more potent than what had been occurring in the past, and that's because of fentanyl. What we're seeing now is about a 30% increase in the fatality rate across the county this year compared to last year. So this is our challenge, and it's a challenge that we are all working together with law enforcement. This is a tough one. This fentanyl is synthetic. It is not sold on street corners. It is sold through the internet. It is sold and delivered in ways that are very difficult for law enforcement to approach. What's really important is that it seems that many, many users don't realize that what they're buying is not what they are accustomed to, what they think they're buying. It's much more potent. And so for that reason, we're seeing increased fatalities. I'll walk you through a little bit of the materials that you have in front of us. Take your questions. Well, maybe I'll walk you through the materials, and then I'll ask Don to talk a little bit about environmental health, if that's okay, and then take your questions. In the packet that you have, just to get you oriented, This first brochure is an overview of all of the services in the health department with phone numbers, and these are good phone numbers. These are phone numbers that Ellen Jones here scrutinizes and scrubs, I'll say, to make sure that they're accurate. And so you can see the range of services that I mentioned: behavioral health, school health, environmental health, and all of the women and children services. You'll also see the health centers that are listed, and again, for general public health work, our center, our locus is in Parole. For substance abuse, for the behavioral health program, our locus down here is at the Bestgate Clinic, which is right across from the mall. It's actually right across from 888 Bestgate, in an office building there. And so that's where we deliver medication-assisted drug treatment, and it's a busy clinic. It starts at 5 o'clock in the morning, and it continues throughout most of the day. The next item that you have in your packet is this is a snapshot of health indicators. It's what we call our annual report card. It gives you an idea of trends, and we could, at whatever your interest is, either express tonight or later, we would be happy to dig down and to do any kind of data dive that you'd be interested in with respect to city-specific health problems. We have a team of data researchers. They're called epidemiologists. One is experienced and two are brand new, and they're very, very eager to dig into data and to answer any questions that you might have. So I would encourage you to please be in touch with me. My card's in your packet there if you have any questions that you'd like explained as far as that report card itself, or any follow-up questions pertinent to the specific to this city. And then on the right side of your folder, you'll see a lot of materials having to do with the substance use crisis. If you put aside the first page, I'm going to come back to that and spend a minute on that. The second is this is a weekly update that your police department and the county's police department jointly issue, and this is a lot of data on here. I think the visual picture is very, very compelling. That's on the second page, and that's a map of the overdoses in the county. The yellow dots being the overdoses, the red dots being the fatal ones. And you can see where we have clusters. You can absolutely see where not only North County, Brooklyn Park, and Glen Burnie, but the city of Annapolis is so heavily impacted. And so this is really a credit to your police department and to the counties that are vigilant in making sure that this is issued every week and is updated in the middle, every Tuesday night or Wednesday morning. It's updated. Some of the response materials that you have, I mentioned naloxone. That's the generic name for Narcan, is the brand name. There's some materials here. We welcome your requests for community groups, for churches, other faith-based groups, for support, recovery, self-help groups, groups that you think would be interested in getting trained and getting supplied with naloxone kits. Absolutely, we welcome those opportunities to do trainings. We are planning trainings at Parole Health Center. We are available on weekends. We're available after hours to come out. We've got just wonderful trainers who can answer all kinds of questions that family members might have, that teachers or faith leaders might have, and really also supply this life-saving medication. So please, by all means, let us know of suggestions with that. The last thing is the material for what your city police department as well as the county does as far as drug takebacks. And I want to mention that this is important. You know, so many of us have from time to time been prescribed pain medication, took a couple pills, felt better, didn't need any more, and stuck them up in the medicine chest. And maybe thinking if we ever needed it, they'd be there. Don't do that. Don't do that. And these are safe ways to dispose of those kinds of drugs. And the reason that I say that is that there is no end to the stories that users, that people with dependence on prescription drugs and then go on to street drugs, the stories that they have told about how they got started, and they got started, some are adolescents, some are adults, but they got started on prescription pills, generally not prescribed for them, that were diverted, that were somebody else's prescriptions. And so what this is a ticking toxin that's in your medicine chest for someone else to experiment with, and for it to be diverted and then possibly to lead to very serious substance use dependence. We've heard testimony from people seriously involved in substance use addiction who had made it their habit, for example, to go to open houses posing as a potential buyer for a property, and really just saying to the agents, I just wanted to see the bathroom, and just going straight to the bathroom, and knowing that they could sustain a habit by going into households where these meds were unprotected. So that's a really important contribution that the police department is doing in order to provide a safe way of disposing of those drugs. Last thing I want to do before I turn it over to Don is to bring your attention to this page of, again, more numbers, but I think this is so important that I did really look forward to this opportunity to share. These are brand new data that have come, again, through the city and county police departments just last week. This is showing a new phenomenon in the city of Annapolis. It's different than it had been in terms of the overdose. Who's overdosing in the city is changing now from what it had been a year ago, and it's also different from what we're seeing elsewhere in the county. We're seeing overall, like I said, the number of overdoses in the city is staying pretty stable. So if you look at the bottom chart, the bottom line down at total, for this year compared to last year, year to date in the city, 61 overdose, in 2017 it was 61, and so far this year, 62 overdoses, so that's pretty stable. But if you see the two yellow cells, the two yellow boxes that are highlighted, there's been a tremendous change in the nature of the user who's overdosing. And again, this is an overdose that results in a 911 call. These are not overdoses that happen at home and that are unattended, but these are overdoses that your police department has monitored. A 50% increase this year over last in African American overdoses. 50% increase is a startlingly significant increase, and it is different from what we're seeing in the county. So overall, this is of note. And most importantly, if you look down at the last line, we are seeing older individuals, 46 and over, are people who are encountering these overdoses. And so this is quite different, and we are going to drill down and look at what is going on in the lives of these folks. Still largely men much more prevalent than women, and that's characteristic both of the city and of the county. But we're looking at what has happened. Is there a new population? Are the substances moving? Is fentanyl moving in a different direction in the city than had happened before? And so we are working closely with some of the mayor's staff on this question, as well as with the city police and Chief Simmons in the emergency management office. These are unanswered questions now, but I think it's really important to bring the data to you. We have some working hypotheses, but we really have to drill down a little bit farther on that. So with that, I'm going to stop and turn it over to Don Kurdian to talk a little bit about the environmental health work that the county health department does throughout the city of Annapolis.
Good evening. One of the biggest programs that we do for the city is the food service facilities. We're responsible for all the inspections as well as the building permit reviews and opening inspections. One of the most important one that we've done recently is just yesterday we inspected the Market House, and they've been approved for all of our health criteria. So once they get all their other inspections, they'll be ready to move forward. So everything was adequate for the health department as of yesterday. So we got that finished. We know how important that is for the city. One of the other things that we do in the city is we don't have many beaches in the city. We only have 2. We have a beach monitoring program throughout the county, which we monitor close to 90 beaches throughout the county. There's only 2 in the city that we monitor, and that's Annapolis Sailing and Admiral Heights. But one of the issues that we're dealing with right now is we are sampling for the upcoming triathlon. Even though that is not a beach, we felt that the city reached out to us, and we felt it would be very good to sample the track where they're actually going to be swimming. And we've tested it. We picked up a sample a month ago just to have a background, and it came back the lowest number possibly for testing results. We tested it last week, and we will be testing it. We picked up a sample today. We will pick up a sample next Wednesday, and we will have 3 weeks of results prior to the race and be able to give those results. The results last week also were the lowest results that can be read at the lab. We've been picking them up every Wednesday. We knew that there were storms predicted for tonight, so we contacted the harbor master this morning. We went out and picked up the samples this morning before the storms so that we have results prior to the storm, and then we'll have another set of samples next week. If all those samples all come back good, we can't close the course, but we can just give recommendations. Like I said, our monitoring program is a beach. We're looking at it just as if we would a beach. We're looking at the results and the monitoring numbers as if it was a beach, just so that when we report what the conditions were for the last 3 weeks, we will show that those results are safe for swimming. Also, we post and close any waterways whenever there's a sewage overflow. We just had one at the Naval Academy a week ago. So that is something that the health department takes very seriously. Whenever there's a sewage overflow from a public facility and it gets into a waterway or anywhere where the public can come in contact with it, we post signs. We also do public outreach through our social media and press releases to make people aware of it. And then we also make announcements when that waterway is now opened up, because we've either had a period of time or an area that we have historical sample results that we would go back and sample, and we would open it based on when those results matched what our history shows. And the other thing that we do for the city is rabies. We get calls when there's bats that have been present in living quarters of homes. In Annapolis City, it's a little different than in the county, because in the county, if we go into a house and we find a bat and there's basically exterior or interior structure deficiencies that need to be repaired, we can either give a notice of violation or a citation to have the work corrected to keep it so that bats can no longer enter the home. In the city, we don't have enforcement authority. So in those types of cases, we give recommendations on what work needs to be done to close off soffits or attic entrances so that they can't no longer get into the homes. But we can't do heavy-handed enforcement, but we can refer it to code enforcement in the city, and we do work with them, and then they can take the case forward if it's something, because in some of the housing units, we do have to work with code enforcement so that the work gets done, because there's many people at risk, and we take rabies very seriously. If a human case, it's fatal if they don't get treatment. So we do all the rabies investigations for any bats that are in living quarters in the houses. With that in mind, another program that also deals with rabies, animal rabies, is our oral rabies vaccination program, which is countywide. We basically distribute 85,000 rabies vaccines that are targeting for raccoons. The city is also baited. We bait the entire city area, including the Naval Academy property as well, and all the subdivisions. And we do it by ground, where we have houses, and by air, where it's more rural. So we've been doing the oral rabies project since 1997, except for 2 years where we had a funding issue, but then we reinstituted it. In 1997, we had 97 positive raccoons in Anne Arundel County, and the Annapolis Peninsula was one of the highest peninsulas that had positive raccoons. Since we instituted and have consistently done the oral rabies vaccination program, those numbers have consistently dropped, and just last year we only had 4 raccoons that were positive throughout the whole county. So as long as we continue to keep that program, we've been very successful by keeping the number of raccoon rabies very, very low. I think historically why the Annapolis Peninsula has high cases of it is, one, it has good geography for it, plus there's a high population of people, which of course with people comes food sources, and that's what the raccoons are looking for, and then you can possibly come in contact with it either in your backyards or in some of the parks. So it's not anything any more than that when I talk about the Annapolis Peninsula. It's just the way the configuration is and the population. And for the most part, that's how the Anne Arundel County Environmental Health Program engages in the city. And if you have any questions about any of our programs, I'd be glad to answer them.
Thank you. I know I have some questions, but I'll open the floor to questions if anyone else on the committee or any of our aldermen have questions. Alderwoman Tierney?
None for me, Madam Chair.
Thank you. Alderwoman Tierney?
Yeah, just forgive me if I, thank you, Madam Chair. Forgive me if I have the wrong terminology here, but with what is it? Is it injected, or what do the police have to stop an overdose?
The Narcan, naloxone, right,
Yeah.
that's a nasal spray.
Is it becoming less effective with the fentanyl?
So that's a really good question. Fentanyl, because it's so much more potent, requires more doses. So what we're seeing now is for people to be reversed out of their overdose, that instead of one dose, it may take 2 doses to turn that around. It's not that the Narcan itself is becoming less effective, it's just the volume of opioids in the person's system is much, much higher.
Okay.
But it's still effective. It still is, it's a
Yeah.
really important lifesaver. And so the more that we can get that out into the community, the better. I think we are now looking at really innovative ways to get those kits out. They're really easy to use, and it's
Yeah.
something that you would have almost like in public buildings. You would have a defibrillator in those kinds of situations where you may have the public coming in. If you inadvertently, or if you administer Narcan to someone who is not experiencing an overdose but has some other kind of health problem that has rendered them unconscious, you will not hurt them. So that's really an important consideration, and that comes up in the training. You cannot hurt a person, but you can save a life with it.
Thank you. And my other question was, you mentioned what was the animal? The bat.
Raccoons?
Raccoons. And what about rats?
Well, rats, we don't do anything in the city for rats because once again, we don't have enforcement authority for housing, and usually with rats comes some human behaviors. Usually it's trash related. We are right now doing a project in Brooklyn Park, and you know, when we went into Brooklyn Park, we saw a high instance of trash violations.
Yeah.
Since we've been in there and doing enforcement, the trash violations have decreased, which has also decreased the rat population. So
Okay.
if anything was being done with rats in the city, it would be being done by your code enforcement people, because we don't have housing authority in the city.
But what about restaurants? Because food service inspections, do they see if there's any signs of rodents?
Absolutely, yes. That
Okay.
is a critical violation. If we went in and saw rodents in a restaurant, we would close the restaurant until they got that under control.
And
So
that's-
as far as food service facilities, any violations like that, we would be looking at.
Okay. Even though it might be related to trash, which the city enforces.
Absolutely,
Yeah.
and trash at restaurants is something we look at, their
Yeah.
dumpster usage, the way
Yeah.
they dispose of trash, the way they store their trash, including their grease barrels, all that
Yes.
is part of our inspection process.
Yeah, but I think we are, for lack of a better word, we're trying to crack down on that with the trash
Yeah.
removal and sealing
Yeah.
their receptacles and all. Thank you very much.
You're welcome.
Thank you, and thank you for preparing this packet that is a wealth of information. I know that you asked in advance how many committee members were there. I suspect to be able to be prepared with this information. If you all would not mind, I would love to get one of these for each of the aldermen, that I may pass this out at our next city council meeting, so everyone has the benefit of this wealth of information in servicing their constituents. It really is excellently prepared and does kind of cut across the board on the services provided.
We'd be happy to do that, Madam Chair. And I do want to, our spokeswoman here hasn't said a word yet, so if I may just slide over, because Ellen Jones, our PIO, is responsible not only certainly for preparing these packets, and she will make sure that you get the quantity that you need, but also all of our written materials and our website. And our website has become such a tool, a valuable tool. Ellen just announced the findings of some of our most popular pages, and I was really surprised at some of the top 10 of the kinds of things that city as well as county residents are going on our website. So Ellen, could you just share a little capsule of that, some of the most popular ones?
Yes. Some of the most popular, as you may expect, are environmental health related, such as the recreational water quality. We have a beach swim guide that is posted every Friday, where you can get the latest beach reports in Anne Arundel County, as well as well and septic system information is also very popular. We also have very popular, interesting open burning, open fire permits, as well as an unusual one was in the top 10 was freezing pipes. So our website is aahealth.org. So please check it out. But we also have AA Health is also the tag for our Facebook page as well as our Twitter account. So please like us, follow us, and you can get instant information through our social media. Thank you.
Thank you. One of the things that I wanted to ask, we were kind of just looking at the recent tragedy that happened at the Capitol building and thinking, how can we all do more to make sure that we're providing all the services we can as government agencies? I know that I used to work out of the Annapolis District Courthouse a few years ago, and the county had a health assessor's office there that did some preliminary drug screening and performed some other supportive functions for the drug diversionary program and the drug court program. Are there any mental health services? I know that the district court there has a robust peace and protective order process, which it is my understanding the gentleman had been a part of that earlier on, not related with what happened. But is there any opportunity to kind of maybe bring some mental health services there on site as well?
Madam Chair, that's a fantastic question, and it really touches on what we are all grappling with, coming to terms with this tragedy. Is first of all, the response from the city, from the first responders, city and county, didn't make a difference. The response was heroic. As tragic as it was, it would have been so much worse. And so I just think we all can feel really proud of what happened. Tragic and really heartbreaking, but at the same time, it could have been so much worse. And so recognizing that, we are across the board, city and county, coming together as we always do after one of these events with an after action. So really a drill down on what went right, what can we improve on, what kinds of gaps, if any, in communication. Although I have to say again, both chiefs, their reaction was, it's not a professional term, but they basically said this was a miracle. It came together where city and county were so integrated in terms of their tactical maneuvers on the scene that you couldn't tell one was city, one didn't matter. It was, they were just trained in a way that was really exemplary around the country. Having said that, we do have some things that we can do better in terms of maybe not identifying this particular individual, and I can't talk about the circumstances of that individual, but looking at what we can do when we have the opportunity to intervene earlier, upstream, so to speak, with people who are disturbed for different kinds of reasons, whether that's in a law enforcement setting, as you mentioned, and yes, we still have assessors, we have drug courts, both district court and circuit court, very important to problem-solving court to work with the bench so that when there's an issue, the crime is dealt with, but also the underlying, whether it's mental health problems, substance use problems, domestic violence, some of the underlying conditions are addressed as well. I can't say enough about the county's Crisis Response Center. This is a group, and actually they're not in the health department. They are in the Mental Health Agency Incorporated. It is a nonprofit, 501c3. It was designed that way to be outside of government. This is the agency that staffs the crisis response people. These are folks They're licensed clinicians. They operate 24/7, 7 days a week, and they do two really important things. They started, as you know, with mental health crises, people in need of crisis who really needed to have an emergency petition, perhaps against their will, to come in and to get treatment in order that they can get stabilized again. That's a police effort, but it also has to be accompanied by a very, very skilled licensed clinician. So for emergency mental health deployment, that's how the Crisis Response Center started. But what's happened since April of 2017 is when the city and the county together, we didn't know, opened fire stations, 24/7, safe stations, as entry into substance use treatment. What we didn't know was the amazing volume, the turnout. So now, those counselors, the crisis response counselors, are also responding to calls 24/7 to fire stations. The Forest Drive Fire Station is the second most, I'll say popular, the second highest volume in the county. That is such a very, very important gateway. It's the front door for people who voluntarily come forward, sometimes on their own, sometimes with family members, and say, that's it, I'm done, I don't want to live like this anymore, I need help. And what they get is the paramedics welcome them, the paramedics do a quick medical check to make sure that they're medically stable, and then on the police radio they are deployed, the crisis response counselors are deployed to that station, to station 40, wherever the individuals are, counsel them, understand exactly what brought them in that day, what level of treatment, what level of care and expectation they actually have, and then move them straight, if they're medically stable, move them straight into drug treatment. It's really an amazing program. We had no idea it would be so popular. We've now exceeded 1,000 people in that, since opening, have come forward countywide into crisis response. So you started by asking about prevention for the kind of tragedy, and really the kinds of work that we're doing in the community, whether it's low level or kind of less dramatic kinds of interventions, or some of these more acute problems. They are bringing people into treatment, getting people stabilized who otherwise could be very disruptive and in some cases very violent. So I feel like there's prevention going on, but prevention, it's the old story. You can't celebrate when something doesn't happen, because it doesn't happen. You know, it's again a learning opportunity for us to look at this incident though and to drill backwards and see what could we have done better, even more, to step up that kind of early intervention.
Thank you. Another area I wanted to ask about, I came across a statistic that said by 2050 that it was giving me the percentage of Annapolis residents that will be 65 and older. It looks like we have an aging population here in the city of Annapolis. Are we doing anything particularly on the horizon with health services?
Who are you talking about?
To plan for that?
I don't know.
Yes, this is the aging population is one that is redefining what aging is, first of all. So age alone, we're changing our culture, our perception of what it means to be 65 or even to be 75. And so the opportunities through the Annapolis, through the county's Department of Aging and Disability, the opportunities for seniors to continue to be active, involved, and most importantly, to be able to live independently are really, they're wonderful opportunities. And you may actually want to invite Pam Jordan, who is the director of that department, to come and talk with you. She's got a lot of very innovative programs and programming here in Annapolis. She and I met, I guess Langton Green is right outside, that's not aging, that's disabilities, right outside the city limits. But yeah, Pamela Jordan is extremely involved in terms of looking ahead at what the demographics of the aging population in the city as well as in the county. As far as health problems, we're doing everything we can to make sure, as I said, that people can stay independent. And so it's so much better for the person to stay at home with supports than have to go into some kind of alternative living arrangement. People generally resist that. They don't like it. They want to stay home. And their health deteriorates and their mental health deteriorates if they can't stay in their independent setting that they're familiar with. So that's really a health issue that we're working with Department of Aging on.
Thank you. That does, thank you. I think we will take you up on the offer to speak with Ms. Jordan to make sure that we, as a committee, are keeping our eye on that ball as well. Do we have any dedicated staff person that works with the city for health services? Or is there anyone who's, is their particular responsibility to communicate with the city or be here in the city? Or are all the health services just under the larger umbrella of the county?
Yeah, that's a good question. There isn't a dedicated city liaison, so to speak, other than the acting health officer. So please don't hesitate to call on me, but lots more people have in the health department have very specialized expertise. There's permanent staff that are based at the Pearl Health Center, and certainly they're known to the community with regard to the services that are offered at the Pearl Health Center. If there are issues, again, that are of interest to the council in any of these areas, please don't hesitate. We don't think about a dedicated Glen Burnie representative or, you know, Lothian or South County representative. We see it across the county, but we'd be really happy to work with you on any kind of issues.
Thank you. I know we have an African-American community specialist, and he reached out to me with particular interest in some of these statistics for the overdoses in the African-American community. It was something that is on his radar. We recently, Alderwoman Pendle Charles led the lead on getting a task force together to kind of study some of the issues in the community. So thank you for raising that awareness, and we certainly will look into that, and I'm sure he will be contacting your office to see what he can do to make sure we're keeping our eye on that as well.
Absolutely, and so we've got a number of issues, a number of coalitions, and again, if there's any opportunity for us to do any kind of education, any kind of outreach as far as naloxone, Narcan training, orientation for parents. We've found, you know, back to school is a good time, and any of the schools in the city, we would love to do informal or formal orientation with parents about a lot of issues. One of which has been tremendously successful this past spring in all the high schools, including Annapolis High School, the back to school, not back to school night, we do that too, but the coaches clinic at the change of seasons. So fall season sports, winter sports, and spring sports usually require parents to come and listen to and engage with the coaches. And at that time, we've got a set of skilled the school nurses, who talk with parents about what they should be alert to as far as opioids, what is an opioid, how if your child is going to get a tooth or a dental procedure or a wisdom tooth extraction, talk to the doctor about what the pain medication is, kind of very practical ideas, and absolutely we would be available to do that kind of presentation for any parent group anytime in the city.
Thank you.
I'm really intrigued by these safe stations. Is there, well, number one, do you have data showing how many cases?
We can get you that. We can get you specific to the Annapolis City.
Yeah, and now they're in just fire stations, or are they also in police stations? I mean,
They're
I know
also, so that's an interesting question, because the concept originally of stations was both police and fire, and that they would be open and available for people. People don't go to the police station.
I know,
They
it's a
just
stigma.
don't go
Yeah,
there.
yeah.
And so I
Interesting.
think in that period of time, we've had 1,000 people come into fire stations and maybe 2 or 3 to a police station. So I think that reflects the feeling. It's not threatening. It's what's called a low threshold. There's not a barrier to go into a fire station. However, it's also true that the police are very supportive, both city and county, supportive of, as well as the state's attorney. I think that's an important aspect. If people come in and they have paraphernalia on them, they have to leave it there, but there's no charges against a person that comes in with paraphernalia. If a person comes in and needs to get into treatment, but they have pending warrants, the state's attorney will work with them to reschedule those warrants in order that they can get through treatment. There's some real serious cooperation by law enforcement in order to encourage people get into treatment and stay there, because they'd rather have them there, of course, than to have, unfortunately, have to arrest them. So it's a really strong partnership.
Thank you. Thank you. I know we have 2 other aldermen present. Are there any questions? Alderman Savage.
Mic on. So my question has to do with the beach tests. I'm guessing you primarily test for bacteria.
Correct. Yeah, and Enteroxide.
Is
Yeah.
there anything else you test for, or just bacteria?
Just that, yeah.
So how do you, so you said you were testing 2 city beaches. Is there a way, no, I want to check with I'd want to check with our Director for Environmental Policy first, but I know there's at least one other beach in the city, Truxton Park, right near the boat ramp, which I could certainly see some value in being tested. Is there a way to expand that if we decide that's warranted, or
Yeah,
if you think
there's,
it's warranted?
there's a questionnaire that we have to do a sanitary survey, and if you qualify, if the area qualifies for a beach, so it's a questionnaire that has to be filled out,
Okay.
and then we do a sanitary survey, and if they meet the regulations for qualifying for a beach, then we can sample that area. So we can get you that application if you like.
Yes, please. Yeah, thank you. I do have another question, Madam Chair. This, I want to yield to my colleague first, but my question would have to do with the foam ban ordinance, which is on the agenda, and I spoke a little bit with our visitors here, our guests here earlier before the meeting, but there are some questions in terms of their department may be responsible for, under one scenario, could be responsible for enforcing that ordinance if it passes. So I think there are some questions that at least I know I would like to ask and get on the record as a part of that. In terms of when you want to do that, I'll leave that up to you. Yeah.
Thank you, Madam Chair, for the opportunity. First of all, I'd like to thank the Anne Arundel County Health Department for being here. And on a personal note, I worked for the Health Department for a little bit, and Ms. Phillips was the one who hired me, and I will be forever grateful for the opportunity. My sense of health was very much heightened, and I learned a tremendous amount while being there, and I thank all of you who were there when I was there as well. I want to mention specifically one particular thing. We're in the process of continuing with looking at our community ambassadors who are based at Annapolis High School, and we brought up part of the information as far as parent issues and the African American Task Force, as well as the Hispanic Latino Task Force that we'll be having, and we're looking for the community ambassadors from Annapolis High School, who are basically the people who are the bridge builders between the school and the community and the parents, who understand and explain certain things that they don't quite understand in the school system. So that's going to be probably some folks that will be talking with you about the issues that we have in the community, especially with the rise in the number of African American overdoses and what we're seeing here now. So just want to kind of let everybody know, and we're looking to hire, we have 4 already community ambassadors, and we're looking for 3 more to do that. And so the city has been kind enough to support that, and we're going to be looking for the school system to take it on next year. But that's going to be a great bridge for you all to talk about these issues as well when we get to that stage. So thank you all so very, very much for being here and what you've provided, and this is definitely human welfare at its core.
Well, thank you, Alderwoman Pindell-Charles. And I didn't know about this ambassador program. It is something that we really want to work with you and support in any way with the school nurses. We've got outreach workers who are work with, some are bilingual, who are able to bring all kinds of kind of practical information to households, to communities who otherwise wouldn't have that opportunity. So we'd be happy to work, really looking forward to working with you on that.
Great, thank you so much. We're covering pretty much all 13 of our public and or subsidized housing communities, so that's what we're on the verge of doing. So thank you so much again.
Thank you.
If there are no more questions about the presentation, I'm certainly happy to have Alderman Savage proceed forward with the questions regarding the ordinance that's also on our agenda.
Thank you, Madam Chair. So regarding, I don't have actually I do have the ordinance in front of me. So the ordinance is the foam ban ordinance, and it's essentially the same version that the county originally passed, except we had not, before there are 2 amendments, we hadn't had a chance to talk about their amendments. But and for my colleagues, I'm sure you're aware, but the county bill failed. I mean, well, it passed, but then it got vetoed, and they could not override the veto. So that is defeated. So that kind of left the question about, well, what happens to the city ordinance? And so if we were to pass this ordinance, our own ban locally, because originally it was to be enforced through the health department, and I just wanted to ask you on the record, would that still be an option if we pass that, to have the health department provide the enforcement through your routine inspections?
Yes, and I'll let Don elaborate on this, but the bottom line answer is yes, absolutely. If the city passes such an ordinance, then in our routine food service inspections in the city, we would add that field. That would be a field of inspection that they, either on a routine basis or on a complaint basis, that our inspectors would observe and record. And if there was a finding, if that was found to be in violation of your ordinance, then as Don said, depending on the wording, it's likely that we would then turn over that finding to your, is it the code enforcement in order to follow through. There have been some instances in the past, and maybe Don, you can talk about that, in the past where the county food inspectors enforced a city-only ordinance and honored that in the city limits. So Don, if you can elaborate on that.
Yeah, one of the we can, as part of our inspections, do the inspection, and if we find a violation, we can turn it over to code enforcement. As far as instituting fines or violations, we don't have that authority. Our authority for food inspections comes from COMAR, and since this is not a COMAR requirement, there is no state requirement for polystyrene ban, we couldn't enforce it and institute a fine or a closure. We could only turn it over to the city for enforcement and to institute a fine if this bill does include a penalty.
Okay. And so it sounds like traditionally you've gone through, if you've had enforcement actions, you've recommended that those have gone through the code enforcement
Correct.
division in the city? Okay.
Yeah.
As I recall, there was a time when the city, because the city's in the vanguard in a lot of things, instituted clean air requirements, no smoking in food service facilities ahead of the rest of us, ahead of the county and ahead of the state. And so we were then charged with enforcing clean air standards in your food service facilities ahead of what we were doing. So that was an example of, I think, parallel, if this ordinance should pass, the kind of enforcement that we would undertake here, but not in the rest of the county.
Okay. Yeah.
Regarding the polystyrene ban, we sometimes get information from other outside parties with their own opinions on how it may impact health. Is there any opportunity for maybe some expert analysis or expert opinions regarding health? We have several city agencies here that we can defer to for environmental matters, for other matters, but I see a need to sometimes have some things fact-checked or to have some sort of expert opinion on some health services. Is there the opportunity?
Madam Chair, I'm so glad you asked that, because that was the situation that the county found itself in. And so because of that, when the legislation was first introduced, the county health department undertook an analysis of the scientific literature with regard to human health. Now, we don't know a lot about animal health other than maybe raccoons, but in terms of animal health unrelated to human health. We did an analysis, and I will be very happy to share that with you as far as the findings with regard to any potential impact on human health. That was, as you will understand, that's one of many factors that entered into the debate. But human health is a really important one, if I'm not biased to say so. So I'll be happy to share that with you, with the analysis that was done on the literature. But also more broadly in the future, if you have that kind of question come forward again, absolutely use us as your health department. Use us as you would to ask for that kind of analysis, and we'd be more than happy to put that together for you.
Thank you so much. Are there any other questions? Well, thank you. Thank you all for
Thank you.
attending. Thank you for the
this
materials.
opportunity. Thank you for this opportunity. I look forward to getting back with you. and to
Thank
your
you.
Thank you for
suggestions
coming
and
down.
questions. Thank you.
Best to the family.
Likewise.
The next agenda item is ID number 22618. It is a update from the Planning and Zoning Department. It is the June schedule of all current planned developments. Mr. Gutwald did email and asked if his presence was necessary. I took a look at the chart that he's provided, and it is very similar to the last one that we reviewed, so I didn't see a need for him to come and do a presentation. We simply could review it for our own information on our own. Does that satisfy the group?
Yes.
Excellent.
I want to be here long.
I will ask our clerk, Ms. Green, when people sign up to speak, has anyone asked to speak at the meeting today? Okay, if we can check to see if we have anyone that signed up to speak, we certainly would. Excellent, we certainly would hear from members of the public before we bore them with our review of legislation.
Madam, what did you want to speak on?
Hi, my name is Jim. I'm on behalf of Fresh Start Church. Underneath Bishop Coates, I'm a referral special outreach, and I came up with a blueprint. I worked in Baltimore for 8 years.
June, I'm gonna stop you for 1 second because
Okay.
we're gonna need you to start over when Ms. Green records your name, and we're gonna need you to be at the microphone. And I'm looking at the list of members that have signed up to speak. I see that Alan Hyatt had signed up to speak. I believe he has left council chambers, but he does know how to find us. I see that Ms. Phillips from the Health Department did sign in to speak. We did hear the presentation from the Health Department. The third person signed up to speak is Ms. June Johnson from Fresh Start Church.
Yes.
Ms. Johnson?
Okay, you ready?
Yes.
My name is June Johnson. I'm underneath the Bishop Coates at Fresh Start Church. I worked in Baltimore for 8 years as a referral specialist, and I put like over 1,000 some people in treatment and dealt with a lot of people from Annapolis that came to my office. So once I had got laid off, I went to Bishop Coates with a blueprint because I noticed that the drug epidemic was very heavy in the African American community. So he liked the idea, and he has been talking to some people at the mayor office about me having a set up somewhere to do referrals and put people in drug treatment. The same people that I had a relationship with and a network with from Baltimore, I still have it right today. Actually, I do business at the church. They come there and I put them in treatment, or I put them on a maintenance program, but also I get to the stagnation why they're using. And it does play a part of mental health first, so they're subject to use drugs to fill that void, so they no longer have to deal with their personal issues. So I came out to speak on the behalf of Annapolis. I'm born and raised there since 1965. My prayer was to come back to Annapolis and help the African American, my sisters and brothers in low-income houses or anybody in Annapolis. So a lot of people understand what I'm trying to do, and a lot of people have my support. I just go around and write up a petition or get them signed it and everything. So I just kept it in prayer. So Bishop's supposed to have came today, but he had emergency, but I still showed up to just tell you about my promotion, what I'm trying to do in the community to give back. And I've been outreaching and fellowshipping with a lot of young ladies that live in public houses over the weekend. We had a big picnic, crabs, listen to music, they playing cards, and they like the idea, and a lot of them actually do need help, so I passed out my business card. So I have 5 business cards right here for you. Bishop had my resume and everything, and he has a copy of what is a referral specialist. A referral specialist is like parole probation would call me, or drug court would call me, and I get them in a treatment program. Now, if they're on cocaine, you can't go to detox. You have to do it psychologically. They just can't go around the same people, places, and things. I get them into a long-term treatment program for a year to 6 months to a year, maybe 2 years. Then I find them a mentor to guide them to learn how to build their foundation, to grow up and be productive to society and move on with their life, interact with their kids, with their mothers, mostly with themselves. So
Ms.
that's what I'm here to speak on.
Thank you very much. Thank you for signing in and for sticking around and for letting us know the service that you and Fresh Start are providing to the community. Bishop Coates is a big part of the community here in Annapolis, the chaplain for our police department, and then very integral in the Eastport Working Together sessions and other aspects of the community here. We have a task force that we are assembling to study issues in the African American community. It's a 1-year commitment. We don't know how often the group will meet, but we are trying to gather folks together so that we can kind of build a think tank to kind of get some data together, get some solutions together. Does that sound like something that you may at all be interested in?
I mean, I don't have a problem with anything, as long as we can get the community back, being a productive society, get the crime rate down. I noticed the overdose rate was 150 for 2018. The age range is from 18 to 54. A lot of them is on opiate, and it is fentanyl out there with the heroin. It definitely is, you know. And a lot of the young ladies that came to me on the weekends is addicted to opiates. So with opiates, man, let me just let y'all know, I'm a recovering addict. So I understand society, I understand a drug use person from a man and a woman perspective. I understand all of that. I was in their shoes before, and I'm no longer in their shoes, so I'm just showing them how I got through it so they can get through it. And a lot of men and young ladies do respect me, and they like the idea, and I have a lot of support. And I have a lot of people that wanted to sponsor me, but I'm letting Bishop do his part. But I just came out, just wanted to share with y'all what I was doing. So basically what me and Bishop has came up with, started with Harbor House Eastport Terrace, where I was born and raised at. So I'm okay with it, and I know a lot of people in every low-income houses and everything. So the crime rate is like on a balanced scale, but the drug rate is up high. So basically what we came up with, to get the African-American men to have dinner, have a big dinner for them, and bring in some men that is a recovering addict to be their mentor. So I came up with options. I told them either they have to live a drug-free life or they will continue going to jail. So they have to think about what they want to do with their life. It's not fair to the younger generation in the low-income community that you come in, y'all sell your drugs to the same people, but you're not helping one another, you're just killing one another, you know. And I was born and raised there, and I would hate to see that Harbor House or 20, that in town, Oberry Court, College Creek Terrace. I hate to see all the projects they get pushed out when they can change their life and do something positive as a productive of a society. So,
Thank you. Thank you for the work you're doing in the community, and thank you for coming to present today. Are there any questions for Ms. Johnson?
I don't believe so, Madam Chair. I'm very familiar with Bishop Coates and the work that he does in the community, and if this is part of it, it's a good program. And thank you for coming in.
Sure.
Excellent.
I just want to echo what my colleague said, exactly. Yeah, thank you for coming in
You're
and the
welcome.
good work that you do. Thank you.
Alderwoman Pendel Charles?
Thank you, Madam Chair. Thank you, Ms. Johnson, for coming here today and bringing your presentation, and I'm sure we'll follow up on it. As Alderman Payne said, we're very familiar, we know Bishop Coates and the quality that he puts forth in the community. But thank you so much.
Thank y'all for listening.
Thank you. Next on the agenda is legislation before the committee. The first piece of legislation is Ordinance 80818, the Adequate Public Facilities Ordinance. We have, for the purposes of amending the test for additional school capacity by requiring schools to enrollment greater than 95% of the state-rated capacity to be listed as closed on the annual school utilization chart and matters generally relating to the adequate school facilities. I believe that it is the will of the group to postpone voting on the ordinance, but to do so in deference to the Rules and Governance Committee, I believe. Alderman Savage is a sponsor of the piece of legislation and happens to be here, so if you wouldn't mind, just for the record, explaining what's going on with the legislation.
Yeah, the legislation, in terms of what's going on with the postponement and what we talked, yeah, so the Rules and Government Committee, we were, and I believe Alderman Arnett is on there as well, and he's also a co-sponsor. But we both decided to agree to postponement because we wanted to get some other experts in the room to help answer our questions. And those experts included Trish Irvin, Irving from the Education Commission, and also a representative from the school, and their name is escaping me at the moment. I can't recall if there's anybody else, but Ms. Green may recall exactly who we requested. So we requested their presence at our September meeting, and we're going to go from there.
Do you know when, offhand, probably not, when you meet in September?
I can check.
So it will be before our next meeting? Okay. Do you know if you all could maybe, if you're making any amendments or doing anything, kind of forward those to this committee as well, so we have the benefit of reviewing that while we're reviewing it too?
Yeah, certainly.
That would be most appreciated. I know that from this committee's perspective, one of the things we noticed when we had Director Gutwald here was that a lot of the developers are not taking advantage of the MPDU. They're opting to pay the fee in lieu instead of providing moderately priced housing in the city of Annapolis. So I was thinking that perhaps from this committee we could propose adding a carve-out or some sort of exception there for developers who did in fact provide the moderately priced housing as opposed to just paying the fee in lieu. And then also I think there was some testimony that would suggest also carving out affordable housing may be something that's worth considering as well. So I know those things are kind of on the horizon on our radar from this committee's perspective, but we certainly will look forward to whatever Rules and Governance has to offer. Thank you.
Madam Chair, I have a question, because I was looking at this ordinance in the capacity of transportation, because I chair the transportation, and it was referred to that, and we did postpone it as well. But what I'm struggling with is that this ordinance is specific to just amending for the school capacity issue. So I agree with you. I agree that we should be looking at carve-outs so that we don't stop good development like you know, perhaps workforce housing or the MDUs, et cetera. But how do we do that in this particular piece of legislation? Do we have to go back and amend another division? It's just it's sort of a legal, because this is very pigeonholed as far as addressing school capacity. And I'm looking for language where it discusses, you know, residential developments. I guess that's the question.
Does not, and
Yeah.
I certainly would defer to the Office of Law
Yeah.
on the particulars of
Yeah.
where specifically,
Yeah.
but it is not uncommon to have a statute give you a prescription and then say, except for,
Yeah.
and then give you all the carve-outs or caveats. So I think there is way to kind of tuck it in here
Yeah.
so that just regarding this specific part of the adequate public facilities, that would not apply if you are building affordable housing. So I certainly would defer to Office of Law on where best to tuck that in, and if perhaps it is more appropriate to have it be its own freestanding amendment to the ordinance in general. But more specifically, I do think that there are areas where we can kind of
Yeah.
say, now having said that,
Yeah.
it doesn't apply to
Well,
this.
thank you. I think I answered my own question where, well, it says that it's the definition of proposed project, but then it refers you to another, it's section 20, notwithstanding the definition of proposed project in section 2204.010, which then, that's where we would probably have to go back and look at that. This legislation can be very comprehensive, you know, but we don't want to lose sight of the fact that we're addressing the school capacity issue.
Absolutely.
Yeah, thank you.
Alderman
Yeah.
Savage?
Madam Chair. Yeah, just briefly on that, I think a number of us would be, I know personally I share the desire to improve and make the MPDU program more effective, and to prevent to help avoid the situation where the developers are tending to pay the fee in lieu more so than actually build affordable housing. And in some cases, you know, I think they have legitimate concerns about it being difficult for them to sell those housing. So I think we need to hear their concerns and figure out how to improve. I still think it's important not to avoid having to build those. However, my point is, I think that's an important discussion, and you know, I'm certainly willing as a co-sponsor to have that discussion and see if we can work that into this legislation. But I'm also wary in terms of what Alderwoman Tierney said. We may end up deciding that it may just need to be a separate piece of legislation. I don't know. But we did talk about a little bit from the Rules and Government Committee about potential carve-outs. Some of us are supportive, some of us are not. But I could, you know, there is certainly, so one thing we want to try to get from these experts is a better understanding about how the capacity numbers are calculated, what the most up-to-date numbers are, what the projections are for the schools, and also get a handle of some of the development projects that might be impacted.
Alderwoman Tierney?
Thank you, Madam Chair. Yeah, to expand on that, could we ask for the most current school utilization chart? That's something that, I mean, again, we can't lose sight that this is about the schools. You know, it's like I said, stop this. It's about the schools, and so we really need to get a handle on, understand the capacity of these schools and where they are. And it does say in the ordinance, it does say that the Director of Planning and Zoning shall prepare one. But I think in discussing this amendment, we should get the most current utilization chart.
Yeah, I did, if I may.
I could ask for that. Thank you.
Certainly, Alderman Savage.
Yeah, I did recently see that. I can't remember if that was sent to entire council or not, but I did just see that recently from the school district. So and I think it was dated July. So I can make a note to try to get that to the entire council.
May I also inquire, Ms. Green, when we consider the legislation again, can we have the school utilization chart from planning and zoning embedded inside of the, we have the staff report and the fiscal impact report that is provided in here as well. Can we also tuck in the school utilization chart? Thank you. Any other discussion on adequate public facilities, ordinance 0818? No. Then we are all in agreement with, do we have to, I will entertain a motion to postpone voting on this.
So moved.
I second that.
All in favor?
Aye.
Aye.
The ayes have it. We will postpone until our next meeting, voting on or making any recommendation on adequate public facilities, ordinance 0818. The final agenda item that we have is ordinance 02218, food handling establishments, polystyrene service products prohibition, for the purpose of prohibiting the sale and use of expanded polystyrene foam products at food service businesses located in the city, providing certain definitions and providing for a penalty for violations. Does anyone have any particular questions about the ordinance or any discussion?
Thank you, Madam Chair. I do, and Rob brought it up. I mean, full disclosure, I own a bed and breakfast. It doesn't affect me as, you know, I don't use the stuff anyways, but I do know that the county does my inspection. So I was very concerned when the county vetoed this. I thought, oh, I thought for sure then that's done because that's in their purview. But this was actually good news that they have done this before. They have some sort of precedence where they can enforce it within the city limits. So I guess this is all pending, you know, law review. I assume we could still vote on it then?
Alderman Savage?
Yeah.
Yeah, I will, it does need to get reviewed again, I believe, by the law department
For language.
to make sure, because I'll just tell you what happened at the Environmental Matters Committee meeting last month. The law office had a recommendation, they had an amendment which simply, essentially cut out everything and just referenced the county code. So that amendment is, we can't do that now since they didn't pass it. So I'm gonna have to, and this is for Ms. Green, I think, at tomorrow's Environmental Matters Committee meeting, I'm gonna have to bring that up again and revisit our recommendations from the last meeting. So basically you'd have to, is that the amendment from the law office? Yeah, so that's basically a moot point now. We're gonna have to, I think, go back with the original, which would create a section of code within the city's code. And I think in light of what the health department said, and here we have C, let's see, it's 10-12-160C. It says the provisions of this section shall be administered and enforced by the health officer pursuant to section 11.6.103 of the Anne Arundel County Code, as may be amended from time to time. I think that still stands. However, we might need to adjust that to make it clear that enforcement will need to be done by the city, as advised by the county health department, and we'll have to set an amount as well. So there's those few things which I think will have to be ironed out. And to be honest, I just saw this meeting yesterday or the day before, and was say, oh, this would be a good opportunity to talk to them. So I have not prepared myself in terms of, as the sponsor, in terms of what I would do to amend it. But so I may not be too much help there, but
No, it lets us know that there are perhaps other changes that are forthcoming. And thank you for coming to the meeting and taking the opportunity to allow the public to also be party to the conversation on what the health office is able to provide by way of enforcement there, so that we aren't explaining that, they got to engage that in real time as well. So thanks for making yourself available. It sounds like our end here is human welfare, that we have a very competent environmental matters committee, and that the human welfare data may still be forthcoming from the county. So our end, where we can best contribute and review or have some sort of meaningful understanding, is not yet before us. So if the committee is fine with postponing voting on this until we have that information.
I agree with you totally. I was going to ask Alderman Savage to provide what the county now has. It was defeated, but I'm sure somewhere we could come up with the text of what it was that was defeated. There may be some amendments that didn't exist originally. I don't know, but as soon as we have all that, I think we would be in a position to take a vote. But as of now, I totally agree with our chairwoman, and I would move that we postpone the vote on this.
Is there a second?
By the way, don't mistake that as me not supporting it. I just think it's
understood.
appropriate to get all the information we have.
Sure.
There's a motion to postpone voting. Is there a second?
I will second that motion.
All in favor, say aye.
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 The ayes have it. We will postpone voting on ordinance 02218 until our next meeting. That completes the agenda before us. Alderman Payon?
Madam Chairwoman, for the good of the order, I would like to say that Alderwoman Pendell Charles, myself, and the mayor had the privilege of attending the ribbon cutting and opening for Bowman Place and the Monument Gardens on West Washington Street on July the 9th, a week ago. For those that don't know it, that was the old Timothy House and Timothy Gardens. And I'd like to congratulate all the parties involved. They did a fantastic job of renovating that. I also was able to take a quick look upstairs while my chauffeur was getting the car. And looking at the rooms, they're small, but nevertheless, they're more than adequate, and the work was very well done. Full bath, large bath, kind of a living room, dining room, kitchen, all in one, along with a bedroom. That was the one bedroom apartment that I saw. Trudy McFall and Homes for America are certainly to be commended, and there's so many people that were involved with this thing, myself included, thank you, that really do deserve to be commended by the council, and certainly by this committee. They made a great contribution, I think, to housing of our older and less affluent residents, and good job.
Excellent. Alderwoman Tierney?
Quick question, Fred. How was that bid out? When I saw Whiting Turner, they're a very good company. Whiting Turner, very reputable. And I was so pleased when I saw them working on that project, and it seemed, the optics looked like it was done very efficiently and without a lot of, disruption, and there was a lot of sensitivity to road closures and all. But how was that bid out? How were they selected?
Well, Homes for America bought the property. It was a public-private partnership. The city did not have.
So the city didn't procure anything there, or no?
We did not have anything directly to do with that aspect of the project.
Okay.
So Trudy McFall would be the person to ask.
Yeah.
Kathy Ebner is in charge of the premises themselves, and she's very sharp. Enjoyed meeting those folks, and certainly enjoyed seeing the good work that they've done. I mean, they really, even before the building itself was done, or a substantial part was done, boy, they were on property. They were making as many reforms as they could in terms of security and safety of the residents. They talk about a transparent process. They were telling the residents everything that they were doing all along. I'm not going to say it was a perfect process by any means, but boy, they were real pros. They did it well, and I think the residents would tell you that they were very happy with the process. They had, I mean, I was there at the meeting when Homes for America first presented, and we had to listen to the sky's falling. We're going to be moved out of here. We're not going to be allowed to come back. And they were able to get around that by doing things one floor at a time, and resettling people in most cases within the building itself during construction. And I'm a big cheerleader at this point for them. I think you would agree from what.
Alderwoman Pindell-Charles?
Thank you, Madam Chair. Absolutely. I echo everything that Alderman Payon has said, and also for his leadership when it comes to that project. But the one thing I do want to mention, when he indicated people were afraid they couldn't come back, that was exactly what happened back in the 60s in what we call the old Fourth Ward. When it went through rehab and all of that and the new buildings, people were, my understanding, people were told they could come back, and they didn't. And so people are now deathly afraid of a lot of what has gone on. And so that history has perpetuated itself. And that's really why they were so afraid, because they knew what happened before, and they felt like they were sold a bill of goods.
Well, we saw a bit of that with O'Berry Court and College Creek Terrace.
Exactly.
Now, it turns out that most of the people, or many of the people some of the people that weren't allowed to return, well,
it was an extreme vetting process.
There were reasons. There were reasons.
Extreme vetting process.
But
that was the trepidation.
Well, yeah, not the case here.
No.
They did really well.
Not at all. Well, thank you, Alderman Pam.
That's good to hear.
That's great, I love good projects.
Yes, thank you. I believe our
No, I
agenda.
prolonged the meeting as long as I could.
I believe that completes
If Ross
the
was
agenda.
here, we'd be here for another 15 minutes, but.
But he's not.
That-
I would entertain a motion to adjourn.
And I would entertain making one.
Is there a second?
And I will second.
All in favor?
Aye.
Aye.
The meeting is adjourned.